Hello, my name is Claire. I'm a registered nurse, and 3 years ago, on October 25th, I posted a video on Facebook about how to use a naloxone kit. I made the video after I saw a lecture by mothers who had lost children to opioid overdoses, and I got a kit myself. Upon opening the kit, I realized it wasn't very user-friendly, so I made a video hoping to teach people how to use the kit properly to save lives. This is a much-needed update to that video. So let's go through the basics. What is an opioid? Opioids are a class of drugs that are often used in the medical field for pain control. Opioids include morphine, codeine, hydromorphone, oxycodone, Percocet, fentanyl, carfentanil, and heroin. Any of these opioid drugs can also be laced or mixed into other street drugs such as cocaine, ecstasy, meth, or speed. Okay, why are opioids so dangerous though? While opioids are fantastic at controlling pain in a controlled medical setting, opioids are highly addictive and are very easy to build a tolerance to. That means a person would have to take larger and larger amounts each time to get the same pain control or the same high feeling. Opioids also have very strong withdrawal symptoms, making cutting back on them after prolonged usage very difficult. Opioid overdose is a very serious condition which can be fatal due to the nature of how opioids work in our body. Signs of an opioid overdose include difficulty walking, talking, or staying awake, inability to wake up even when shaken or shouted at, choking, gurgling, or snoring noises, slow, weak breaths or no breathing at all, blue color to the fingertips or lips, cold and clammy skin, dizziness and confusion, and very small pupils. Okay, but is the opioid problem even serious? Short answer, yes. Long answer, yes, yes, yes. Let me give you some statistics from the Government of Canada. There have been more than 12,800 opioid-related deaths from January 2016 to March 2019 across Canada. 3,023 deaths in 2016, 4,020 deaths in 2017, 4,588 deaths in 2018, and we already had 1,082 deaths by March of this year. 93% of all opioid overdose-related deaths were accidental, meaning the person did not knowingly ingest the opioid or did not know the dose and strength of the opioid they were taking. 76% of accidental overdoses were male. The most affected age groups are people 30 to 39 years old, 26% of accidental deaths in 2019, 40 to 49 years old, 20% of accidental deaths, and 20 to 29 years old, 19% of accidental deaths. There is no province in Canada that is not affected by this epidemic. These maps are from the Government of Canada website and show that this is a widespread problem across the whole country. The numbers are only going up. People are accidentally dying from prescription drugs, laced drugs, and unknown high doses of opioids. This is an issue that needs our attention and action. So, what is naloxone and why is it so important? Naloxone, or Narcan, they're the same drug, is the antidote drug for opioids. When given, it can reverse the symptoms of an opioid overdose and can save lives. Naloxone kits are available for free at any Canadian pharmacy. You do not need to provide your name, your health card, or any information about yourself. There is no excuse for you not to have one. Let me show you a demo on how to properly use the kit and medication because it's a little tricky if you are not familiar with the supplies. Okay, so this is the kit. When you open it, it has the following contents. 3 vials of naloxone, 1 milliliter per vial, 3 syringes, 3 alcohol swabs, 1 pair of latex-free gloves, 1 CPR mask, and 1 instruction sheet. Now, when we are in a situation where we need to use the kit, a couple things need to be done before we give naloxone. The instruction sheet has a helpful step-by-step process that we will go through together. If you are with someone or find someone who you suspect is overdosing, having the symptoms I previously mentioned, you need to attempt to stimulate the person to see if they are responsive. Yell at the person or rub your fist along their breastbone of their chest. If they do not rouse or keep falling back asleep, call 911 immediately. Do not let the person sleep it off. Now that you have called 911, check to see if the person is breathing. Is their chest rising and falling? If yes, place the person into recovery position. Roll them onto their side, one hand supporting their head and the other out to support their body. Watch their breathing and stay with the person until help arrives. If they are not breathing or breathing very shallow, not regularly, or it looks like the person is struggling to breathe, you need to start rescue breaths. Tilt the person's head back and lift the person's chin up to get a clear airway. Using the mask provided in the naloxone kit, place the wider plastic part, the side without instructions, into the person's mouth. Keeping the person's head tilted and chin up, pinch the person's nose and breathe into the mask to give them breaths. You will see their chest rise. Continue this every 5 seconds for 2 minutes for a total of 24 breaths. Assess if they are breathing after this. If not, naloxone should be given. To get the naloxone out of the vial, take the cap off. I am using my old naloxone kit, which has expired for this demo. Open the syringe packaging. You will see the syringe has number markings on it. These are milliliters. Do not push the plunger all the way to the top. This will auto-lock the syringe, which means the needle becomes covered and the syringe cannot be used. Insert the needle into the vial like so. Now rotate the vial upside down and hold it in a way that is comfortable for you. This is how I hold it. Make sure the needle is in the fluid of the vial, the bottom quarter of the vial. Draw back the plunger and you will see fluid fill into the syringe. Draw back the full 1 milliliter. You will have to lower where the needle is in the fluid to get it all the way out. At this point, you will have a syringe that has naloxone and air in it. Holding the needle up, slowly push the air out until drops of naloxone form at the tip of the needle. You will not hurt a person by injecting a small amount of air. It is more important that they get the life-saving medication, so do your best to reduce the air, but it doesn't have to be perfect. Now the naloxone is ready to be injected. Now that we have the naloxone ready, we can inject it into a muscle, the outer thigh, the butt, or the deltoid, where we get our flu shots. It says this medication can be given through clothes, but I would recommend trying to get access to the skin if possible. To inject the medication, hold the spot with your non-dominant hand and insert the needle at a 90-degree angle. Don't be scared to hurt the person. They need this medication and they need the needle to get deep enough and not to bounce off. Insert the needle into the muscle with intent. Once in, inject the medication by pushing the plunger down until it auto-locks with a click sound. Naloxone works within 5 minutes of being injected. The person may start to breathe more regularly, open their eyes, may be confused, and may even be irritated. Stay with the person until help arrives. If the person does not wake after administering naloxone, administer another dose after 5 minutes. Do this in 5-minute intervals until you do not have any naloxone anymore or the person becomes responsive. Okay, with all this being said, what are some reasons why people might not want to inject naloxone? I don't know if the person is overdosing. Can I give them naloxone? Yes, you can. If you find a person who is not breathing and you do not know if they are overdosing, after doing rescue breaths, you can safely administer naloxone. If the person is not on any opioids, naloxone has no effect on the person and will not hurt them. Better off giving it and having it work if they need it. What if I have some illegal substances on me? In Canada, we have the Good Samaritan Act, a law that protects people acting to save someone's life in an overdose. Under the Good Samaritan Act, when you call 911 for help, you are protected from being charged for possession of illegal drugs or any breach of pretrial release, probation, conditional sentences, or parole involving possessions of illegal drugs. Okay, that's great, but what if I don't have a kit? There is no excuse for you not to have a kit. They are free and they are available at every Canadian pharmacy. So please, this problem is not going away, it is just getting worse, and it affects all of us. Please share this video to help raise awareness of how to use the kit properly. Let's save lives together. Thanks everyone. Hope you're having a great day.